Hello all, this is Dr. Kaustubh Mohite, your pediatric pulmonologist. Today, we are going to discuss another interesting topic which will be helpful for both pediatricians as well as parents. So before we start, kindly subscribe to this channel so you do not miss any video which I shall be uploading concerning to the field of pediatric pulmonology. When you suspect any allergy in a child, it is of utmost importance to get a detailed history of the complaints as well as the environment. So today, with the help of these simple 10 questions, we will learn a systematic approach of how to take a concise yet complete history of a child with suspected allergic complaints. So our first question should always be, what is a child's symptoms? This question is of utmost importance once it comes to taking a history in a child with suspected allergy. It forms the basis of our diagnosis, as the symptoms will guide you whether the primary involvement is of upper airway, commonly termed as allergic rhinitis, or involvement of lower airway, commonly known as asthma. Symptoms of allergic rhinitis mainly involve nose block, runny nose, sneezing, rubbing of eyes and nose, or allergic shyness, that is, the dusky colored skin below the eyes. Symptoms of asthma involve cough, difficulty in breathing, whistling sounds while breathing, or just generalized tiredness. The second question that should be asked is about the timings of these symptoms. A child complaining of nose block and sneezing during morning hours immediately after waking up from sleep is very typical of allergic rhinitis. Cough which is more during the night time, or child waking up from sleep because of coughing, intermittent daytime coughing, or cough which is aggravated by physical exertion is typical of asthma. The third question that should be asked is that since how long has the child had these symptoms? Getting a detailed past history is very important, as we need to know the total duration for which the child has had these complaints. Some allergic manifestation evolve with time. A child may manifest with skin allergy in the form of dry skin or urticaria during early infancy, which may progress to allergic nose in early childhood. If not treated properly, this may further progress to asthma. This is very typically termed as allergic march. The fourth question to be asked is about how frequent have these symptoms been in the last 4 weeks. In order to grade the severity of these complaints, we need to ask the frequency of complaints mainly in the past 4 weeks. One should ask the number of episodes during both morning and night time, as well as the number of times medications were required to relieve these episodes. If at all the child is already on medications, this information will help to grade the control of underlying disease. The fifth question should be regarding what allergic triggers is your child exposed to. An allergic symptom is our body's response to an otherwise harmless substance. In order to control these symptoms, it is of utmost importance to know the exact cause which could be further prevented. These triggers could be either indoor or outdoor. Indoor allergens mainly include dust accumulation on the woolen material, damp walls having fungal growth, pets, any smokers in the house, or any specific food product to which your child could be allergic to. House dust mite that feeds on dust particles accumulates in your house, and their secretion and fecal matter are highly allergic. Outdoor allergens mainly involve plants, pollen grass around the house, any construction site, as well as the ever-growing traffic. The sixth important question that should be asked is about how is your child's sleep. Sleep forms an integral part of normal growth and neurological growth of your child. As most of these complaints are during the night time, sleep is significantly affected. Frequent snoring, nighttime awakening, tossing and turning while sleeping, bed wetting, gasping and choking while sleeping are typical symptoms of obstructive sleep apnea, which is commonly seen in allergic signs. Other indirect complaints indicating altered sleep include morning headache, child not being refreshed after sleep, a child being lethargic or hyperactive during morning hours. The seventh important question should be regarding a positive family history. A positive family history is very commonly seen in allergies. Allergic manifestations in at least previous 2 generations should be asked in child with suspected allergies. The next question should be regarding, has the child been on any treatment in the past? Some children might be having these allergic symptoms for a significant duration in the past and might have been already started on anti-allergy medications by other doctors. It is important to know this information as you get to know how to plan your further line of management. If at all these kids are on medication, the next question to be asked is, how is the compliance of these medications? If at all the child is given any form of medications like meter dose inhaler, nebulizer or a nasal spray, it is necessary to know how sincerely the medication is being used. Also important to know is the number of missed days of medication after which the child has started developing these symptoms. And finally, the last question to be asked is, how is the child taking these medications? That is, whether the child is using proper technique or not. The commonest cause of uncontrolled or poorly controlled symptoms even after starting treatment is improper technique of administration of medication. One should make sure that the parent and the child is well trained in how to use an MDI or a nasal spray. Also, very important to know is that the parent must be instructed to get their medications on each follow-up visit so that the technique of the medicine administration can be checked each time. So these are the 10 questions that one must ask whenever a child presents with symptoms of allergy. This will not only help us to take a complete history, but will also help guide the therapy and counsel the parents. I hope this practical video was helpful to you. Thank you.